with Dr. Van Wong, a dentist in Federal Way, right? That's the city in Washington you're in?
That's right.
Yes, Dr. Wong, let's talk a little bit about root canal. Now, people, you know very well that when we have anything going on we really don't like, we say, wow, this is as bad or almost as bad as a root canal. Basically, root canal, maybe wisdom teeth, those are the two things. It's like we just threaten it almost more than going to chemotherapy or something like that. Is a root canal really still such an ordeal to do? Because last time I had one, which was I think 12, 14, 15 years ago, rather than being bored in the chair for about 40 minutes, nothing was going on. It looked fine. I mean, it was just like a cleaning. In fact, it was more comfortable than a cleaning. Tell me a little bit about it, and also, of course, tell us why a person would need a root canal. What are some of the symptoms we experience where we know, oops, that spells root canal? Please.
Yeah, root canals have really gotten a bad name through the years because patients, they tend to wait too long before they go see a dentist, and they always come in to the office with pain that's so severe that that anything touches the tooth would hurt it. And so a lot of times those patients go on to get some treatment, which the treatment becomes uncomfortable because the patient's waited too long, and it almost makes it almost impossible for us dentists to actually get it numbed up.
I see. So basically, when the infection in the tooth, I suppose that's what it is so big and so huge already, because infections don't they don't respond to the Novocaine, right? So then that area that area keeps being sensitive to whatever then you do. Is that what it is?
That's right. That's the reason why I always recommend my patients to come in to see us as soon as they have any kind of symptoms with their tooth, or anytime they sense that a filling is broken or any kind of symptoms, they should come in immediately to get it checked out.
Mm-hmm. So is pain a toothache, the normal toothache, which, personally from my own experience, there are kind of toothaches which they feel they come from the tooth. It's probably a cavity or so, I'm not so sure. And then there's this toothache which it starts like way up there in the flesh here. Is any toothache usually meaning that there's something wrong with the root and it needs to be fixed?
Not necessarily. You can have toothaches just from chewing on the tooth at a wrong angle. And you can also have toothaches from catching a cold. Sometimes you have a sinus infection from just a normal cold, and that can cause a toothache. So it doesn't necessarily mean that there's something wrong with the tooth, but it's always a good idea to get it checked out to make sure that there's anything wrong that we can fix and address immediately.
And do normal x-rays, do they show that there is a root canal in the works, kind of like, or not really?
No, sometimes it can show that. Sometimes if it can show like a big cavity that's really close to the nerve, or a filling that's really close to the nerve that might be irritating it, or sometimes an x-ray can show like massive amounts of infection around the apex, the very tip of the root of the tooth, then those signs would be kind of obvious that the tooth would need a root canal. But other times, the x-rays don't necessarily point out something that might not be obvious. So it takes further tests in the office to determine if the tooth needs a root canal.
Right. So the normal regular, more or less regular for most people, it's 6 months. For some, it's 2 or 3 months, based on how much calculus they build up. But the normal regular checkups, usually every 6 months, there's an X-ray accompanied with it, more or less. Yes or no?
Yeah, that's right. We try to take X-rays to prevent problems, maybe once every 6 months, or maybe once a year.
So those normal checkups, should they be able at least to prevent that the tooth is very flared up and then the root canal becomes difficult? Because what you're saying is, if you do the root canal not too late, where it's like fully infected, then it's really not a big deal. The only time it's difficult is when it is already so infected. Like with all illnesses and problems, if it's very heavy, very, very bad, then it is always more painful and more difficult.
That's right. And if we can catch it early on enough, before the infection just flares up, then we're able to anesthetize it and treat the root canal with no pain.
Mm-hmm. Now, once a tooth has a root canal, is that tooth prone to in itself decay faster because it becomes more brittle because it doesn't have the root in it? I mean, there's all kinds of rumors going on. Shed some light on it, please.
Yeah, that's true. Once the tooth has been root canaled, the nerve and the blood vessels have been taken out of it. Therefore, there's no a supply of blood to the tooth. That makes the tooth more brittle, and therefore, what we always recommend is getting the tooth crowned so that it helps protect the tooth from fracturing in half. So all root canals, especially with the back tooth teeth, like molars where we put a lot of forces on when we eat, will require crowns to help protect it.
So that A, because it might most likely become more brittle, and B, you put a hole in it so the tooth isn't anymore a stick. It becomes a pipe, and a pipe can break more easy, I guess.
That's right. That's right. A lot of the times the teeth that get root canals, they have decay, like 70-80% of the tooth is all decayed. So what's really left of it is just 20-30% of its natural tooth structure, and that's not enough to actually hold up the tooth for over a long period of time.
Right.
And that's why there's a need for the crown.
Right, and then I've heard if it then does, if you have such a situation which you just described where the tooth obviously is weakened, otherwise you wouldn't have needed a root canal in the first place. Root canal weakens it a little more because it doesn't get the nutrition anymore. It basically gets a little brittle, plus you probably grind it down to build a hole. If then such a tooth breaks because it wasn't crowned, it breaks in very weird ways, and taking those splitters out, because they sometimes break below the gum line, again is if it happens, doesn't necessarily happen and cannot be predicted when it might happen, but if it does happen, it's in itself quite an ordeal to fix that sometimes. Is that true?
That's true. If a tooth breaks, it depends on where it breaks, but a lot of times if it breaks far enough below the gum line, it actually makes the tooth non-restorable. And then the only choice is to take the tooth out and replace it with something with an implant or a partial denture or a bridge.
Mm-hmm. And even that's a heavy operation, kind of a relatively heavy operation, because you have nothing to grab on anymore, right? You need to dig in. So anyway, look, you said something about you taking the nerve out. So tell me again. Are you really, is the root going to come out, or is it something else which is, somebody told me that root canal theoretically is a misdemeanor. It's not really, you're not really removing the root. Can you tell me about that?
Yeah, that's right. A lot of patients do come in thinking that we remove the root, but we actually don't remove
root canal. I mean,
yeah. So the only thing is what we're doing is we're cleaning and shaping the inside of the tooth, which involves the canal itself, the canal and the pulp chamber, and all the tissues that are on the inside of the tooth. So no root gets removed. Simply just the pulp chamber and its canals get cleaned and shaped out.
I see. All right. Well, wonderful. Well, has technique, let's say over the last 30 years or so, or 20 years or 15 years, are there some techniques? Because it looks to me like a pretty hands-on, straightforward thing. You go in with a little file, with a little, things to grab it, and it has nevertheless, have there been some improvement which patients should be aware of, that why it is overall much more comfortable these days and less painful and faster and all that stuff than it was maybe?
Yeah, root canals have really changed a lot in the last 20 years with the invention of rotary files. Before, almost all dentists were using hand files. So we were doing it manually by hand, and it would take probably 3 hours to complete one molar root canal, 3 hours or more. But nowadays, with the invention of rotary files, it takes about an hour, hour and a half at most.
I see. So that in itself is a huge advancement. All right.
Yeah.
Well, wonderful. All right. Anything else you would like to tell us about a root canal? Something I didn't ask you.
No, overall, I think the main thing for patients to know is just to make sure that they come in early if they have any kind of symptoms, that have the tooth checked out, and don't wait too long, and don't wait long enough where the tooth totally becomes flared up and it's very painful. And then when you come in at that moment, then it makes everything much harder.
All right. Well, thank you very much for your candidness. So I guess what we learned here is do go and get your regular dental checkups, because certain things can be then seen that they might be building up and can then be monitored. And especially if you have a toothache coming on, don't try to swallow it down with strong whiskey and then it goes away or something. Just go in and do it, because when it becomes bigger, then yes, you might have difficulties numbing that area. So on one hand it's hurting, on the other hand you can't even numb it, and so you're kind of like between a rock and a hard place of doing the operation. And that's where root canals got their bad name, I guess, their bad rap, by just waiting way too long. Is that correct?
That's right.
Well, all right, let's not do that. Not an easy thing to do with, going to a dentist. It's not like going to a movie or buying a new shirt where, we like not to wait too long. Thank you very much.